Can menopause aggravate your IBS? Yes, it can. Let's talk about why and what you can do about it. If you suffer from irritable bowel syndrome or IBS pre-menopause, you may find that going through perimenopause and into menopause that your IBS symptoms change. Menopause does affect irritable bowel syndrome. The hormones that decline in menopause, both estrogen and progesterone, do affect your bowel function. Progesterone has a calming effect on the bowels. And as those levels start to fall in perimenopause, you're going to more likely suffer from cramps, diarrhea, and abdominal pain, especially if you have IBS. Your progesterone levels have fallen and you no longer have that calming effect that progesterone would have on the gastrointestinal tract. Now, estrogen tends to keep things moving in the intestines, and as your estrogen levels fall in menopause, you may notice that you become a little more constipated with more gas and bloating. Your bowels peristalsis, the movement of the smooth muscle that keeps your digestion going and your bowels clear, is slowed down because of your low levels of estrogen in menopause. Now, the effect starts not just in terms of defecating, but in terms of digesting. So irritable bowel syndrome can be aggravated in menopause by indigestion and malabsorption. We make less estrogen through perimenopause, and it kind of bottoms out in menopause and postmenopausally. So we're more likely to suffer from indigestion, and that's because estrogen helps your stomach make more hydrochloric acid, and it helps your liver make healthier levels of bile acids. So your protein and fat digestion is definitely affected in menopause. And as you go through menopause, you tend to have more indigestion and more bloating because your progesterone levels have fallen as well, and you tend to be a little more sensitive to high glycemic carbohydrates like starches and sugars, which can cause more bloating and gas. As your hormone levels start to fall, they affect your bowel flora, those friendly bacteria that live in your colon that help you digest your foods, metabolize your vitamins and your nutrients, and just basically keep you healthy. The low level of hormones in menopause do not promote a healthy environment that your gut bacteria needs. So you have less of these healthy flora, and your digestion is going to be off, and you may experience gas and bloating, abdominal cramping, and a change in bowel movements. Now, you need to be aware that if your change in bowel movements is sudden, if you see blood in your bowels or you see mucus, if you're having extreme pain, you need to be seen by your healthcare provider. If you have a family history of colon cancer, you may need to have a colonoscopy by the time you're 50 years old. Again, discuss this with your healthcare provider. What's the best screening for your particular colon based on your family history and your issues with irritable bowel syndrome? Now, in some cases, certain menopausal women who had very anxious irritable bowels in their youth and were more affected by the roller coaster of their hormones going up and down throughout their menstrual cycle in their reproductive years, all that kind of calms down after menopause. So that can be a good thing. In fact, they may go from irritable to a little bit constipated. So be sure that you're eating enough fiber in your diet, lots of colorful fruits and vegetables, whole grains, and drinking lots of water, staying hydrated to keep your bowels regular, and that's also good for you whether you have diarrhea or constipation with irritable bowel syndrome. IBS can be hard to live with, and going through menopause can be challenging as well. So if you're having any issues with your menopausal symptoms aggravating irritable bowel syndrome, please, why don't you join us in our hormone support group? We have frank discussions about these things all the time, and you can get access to it through my hormone reboot training. The medications that you may be taking for irritable bowel syndrome premenopausally often change when you become menopausal, and you may find that your needs for medication are actually much less as your bowels change. So definitely discuss your symptoms with your healthcare provider as you're starting to go through the change, hopefully as early as perimenopause, so that you can be aware of adjustments that need to be made in order to stay healthy and have healthy bowel function. Now check out my next video for more women's healthcare tips.